We welcome you back to CBN today. Again, thank you so much for joining us. We have lots in store for you, second half of the program. And it is my pleasure also to welcome to the studio the lovely Dr. Cindy M. George. She's a mental health counselor and the director of Cimorge Counseling and Consultation Services. Dr. George, welcome to the program.
No, thank you. Thank you for having me.
It's a pleasure to have you.
Good morning.
Good morning.
I know that you are, you got here early, although your office is in this building, upstairs on the third floor. So it's nice to know that you don't have too far to go.
Don't have to go too far, yes. Just run downstairs.
Yeah, well, thank you.
Yes.
So you're here to speak with us today about eating disorder. And the first question we are going to ask you is, can you define eating disorder for us?
Yes, define eating disorder. Okay. First, before I define eating disorder, I just want to say any disorder, okay, is what we're looking at. We're looking at continuous pattern, right? So with an eating disorder, we have a continuous pattern of behaviors whereby the person is trying to control the weight. That's the hallmark, that they're trying to control their weight, okay? Now, we can also want to distinguish that maybe too with overeating, because with overeating, they're not necessarily trying to control their weight, they're just eating excessively, okay? So the hallmark feature of eating disorder is that they are trying to control their weight. Now, there are three kinds of eating disorders. The two main ones we know are anorexia nervosa and bulimia nervosa. And then we also have the binge eating as well, okay? With the anorexia, those persons are called anorexics. And those are the very thin, I mean very, very thin. They refuse to maintain minimal weight for their age and for their height. And so we see them very thin, very, drawn down. Those persons exercise excessively. I mean, they exercise continuously, even when, let's say, they have reached their goal, and they reach that goal and they still continue to exercise because they think, I need to lose more weight. I need to lose more weight. Okay, so that's another feature. And a third feature is just eating foods. If they do eat foods, they eat foods that are low, very low in calorie, very low in calorie. And also, too, you see them starving themselves because of this thought that they just can't ingest. They just don't want to gain that weight. So those are some of the symptoms, some of the features and the signs that we see with anorexia nervosa. Sorry. With bulimia, however, there's a slight difference because you wouldn't really think somebody has bulimia because guess what? They're not thin. They're normal size. They're normal size. But what happens with bulimia is that the hallmark feature of that is eating and purging. Meaning throwing up, right? So with bulimia nervosa, you see persons that would then ingest large amounts of food, they would eat a lot of food, and then they would self-induce vomiting, okay? Because the goal there is to get it out.
Isn't that dangerous?
I got to get it out. Yes, and we can talk a little bit about what are some of the medical complications when you do that. Yes, definitely. So we'll hold that thought. Yeah. Yeah, definitely. But one of the hallmark features is just simply eating and then again sticking your finger down your throat, inducing that vomiting. Because a person with bulimia wants to get rid of the food, they use laxatives. And with laxatives, a lot of times what they're doing, they're using that to purge, to get the waste out, right? We see the use of a lot of diuretics. These are things like water tablets, water pills. And what's happening is that they're losing fluids, especially urine. Okay, so they're getting a lot of that fluid out via that. Enemas. Go to the extreme of using enemas as well, just to get it out, right? So those are the features of bulimia. Associated with that. And a lot of times with bulimia, you'll also see a lot of, and with both bulimia and anorexia, some other psychological disorders. You'll see co-occurrences, depression. You might see that. Persons with bulimia may also be suffering from maybe sexual abuse, physical abuse. And so that's their way of dealing or coping with it. Is the eating and the purging. Because what happens with bulimia, there's a sense of control. Because think about it, if you have somebody that has bulimia and they say, okay, I'm going to eat and then I'm going to get rid of it That's a sense of control because they control that part of it.
Yeah.
And imagine if someone that has been abused or is being abused, they don't have any control over that.
That's true.
You know?
Yeah.
And so what we see is, you know, in instances that can be a side that, you know, that's happening to that person, psychological factor that's contributing to it. And the purging can be a reinforcer, you know, because if that sense of control and relief that I can control something, yeah? And again, the third one, binge eating. And we see that too sometimes with bulimia too, because binging is where you eat a lot and then you throw up. They're about, let's see, with binge eating, we have the characteristic of, imagine those persons that sit on the couch and they pull all the potato chips and they pull everything and they just eat so quickly.
Yeah.
That's one of the features of binge eating, very fast eating. You're
Really?
eating very quickly, yes. And you have a question.
Oh, Lord.
You binge eat?
I
But-
eat like quick.
but one thing I want to say,
Fix it, my dear.
one thing I have to say, right, with disorders, remember, you don't have the diagnosis unless you meet a few of the criterias.
Oh, okay.
So just because you have one, don't worry.
You eat it like a pig.
Right, don't mean you have it.
Just because you eat it like a
Right,
pig doesn't mean
you have it.
Okay.
You have it.
thank
So some other features, you tend to eat alone because you're ashamed of the and how much you eat. And you eat so much in a space of time. Let's say, for example, you might eat in a space of 2 to 3 hours something that another person will eat over 2 days. That might seem excessive, but the point is that you eat so much for that allotted time.
Right.
That's another feature there of the binge eating. And another feature, again, would be definitely the concern of the throwing up.
Right.
Yeah? So those are some of the features of the binge eating. And again, they're similar to the bulimia as well. So those are the three types. Yes,
Yeah.
that according to DSM.
I have had a friend, I should say, I have a friend who has had 2 of her daughters. One had anorexia and one had bulimia. And so what you're talking about, I've witnessed with them. And I mean, right now they're married, but the one with the bulimia is still in that stage.
Still struggling with
Still
it.
struggling with it. So what are some of the effects on the body from
talk about
these
that.
disorders?
Well, let's start with the anorexia. With anorexia, and you mentioned females, one of the things that parents may want to look at, especially in young girls, and even females, older females too, you have a cessation of the menstrual cycle. The menstrual cycle discontinues for about 3 months.
Really?
And that's called amenorrhea.
Okay.
I think I said that correctly. Yeah. And so that's because of the how you're treating your body, the lack of nourishment, hormones, everything. So your menstrual cycle actually stops for 3 months. That's one of the criteria actually for diagnosing that disorder. Again, with anorexia, you might also find things like irregularity in your heart, anemia, hypertension, low blood pressure. So those are some of the side effects that you have. What side effects? But those are some of the complications or medical effects that you have with anorexia. With bulimia, just imagine constant throwing up, the enamel of the teeth, right?
Oh, yes.
Tooth decay, right? The lining of the mouth also, it's because the acid continuous, right? So that's one with bulimia.
What does it do to the stomach?
Exactly. The lining of the stomach, that continuous, the esophagus, continuous throwing up again. That damages that as well, right?
Okay.
So we see a lot of that. And so with bulimia also too, because of the continuous getting rid of the things, potassium, low potassium. So you see a lot of instances where you are really suffering from a loss of those nutrients, okay? And persons can become hospitalized with both of those eating disorders, especially if you've lost a lot of weight and you're not able to function. You may need to be medicated, things like that. So there so many complications that can happen.
You mentioned initially that domestic or sexual abuse may result in. What are some of the other triggers that will cause people to
some
go
of the
into
other
that
causes?
mindset?
So, definitely. We want to look at some psychological features. Let's take, for example, and again, one thing I have to say with the eating disorders, it's somewhat of a mindset. and we get that from the social media, what is out there. And it's like all of the unrealistic expectations for women, the thinness, expectations of roles of a woman. And also, too, males do have, these eating disorders as well, but it's mostly prevalent in women.
Yeah.
So we see that. We see also, too, with young girls, and it's somewhat more prevalent with young girls because what's happening, if we think about it, that stage of their life, they're doing what? They're developing, they're trying to find their own niche, their social connections to their peers, and a lot of that peer pressure comes and finding their identity. So a lot of times we got a lot of psychological issues, low self-esteem, not a sense of identity as well. So those are some of the psychological factors, and the social factors again, with the stereotyping and the roles of the media, what has to be played there.
And the fact that all these celebrities and models out there trying
very thin, very
Listen, be careful how you talk.
Oh, sorry.
Because you are a celebrity, and look at you.
I look
so
fine.
you're contributing to it too.
I look fine.
Yes.
and the key is, are you the weight for your height and your age?
Well, I am 5'5". How much am I? 5'7".
Yes.
Yeah, and I am 143 pounds.
Yeah.
That's the
So if
weight
that's
for me.
the
That's
normal,
the normal weight
then
for
you're
me. Yeah.
there.
So, but when you see all the young girls struggling so hard, even some old people. I mean, have you seen people, older folks with these ailments?
Yeah, and people think that it might be just for young girls because they're trying to find themselves, but sometimes you can also find it in midlife persons, 30, 40 years old.
Yeah.
And what happens is not necessarily that they get it at that time, but they may have had it previously and they relapsed.
Oh.
Okay, so that's what could have happened, because it's a continuous process. You're not cured from it.
Okay.
You're not cured from it. You just learn how to live with it via treatment, via the support of family and friends.
Yeah.
Okay, and then you learn how to maintain it. And if we can talk a little bit about treatment.
Yes.
With treatment.
What sort of treatment other than hospitalization?
Well, hospitalization really comes, for lack of a better term, as a last resort. Again, if the person is so severely underweight.
Yes.
And also to hospitalization from my experience as well. And I think I had shared with you that I worked with teenage girls that were suffering from eating disorders, specifically bulimia.
Right.
And what you see is they're hospitalized because you want to break that cycle of the binging and the binge eating and the purging. Because what happens is, when you're in the hospital, that can be controlled via behavioral therapy.
Right.
And I remember having patients at the hospital whereby they would eat, and then you would actually have someone be with them all the time to ensure that they don't do induced vomiting. And so that's you're trying to break that cycle of binging and then purging.
So you have to watch them around the clock.
You got to watch them. Watch around the clock. And then another thing, too, with respect to behavioral therapy is just reinforcement. If they continuously do it, you give them a reinforcement. You give them a token or something to, again, it's just modifying the behavior and changing it like that.
But what about when they're at home? What do the parents have to do?
And that's where family comes in, because you need family to monitor. You need family to continuously be, giving their support and just reinforcing a lot of the things. And family also too needs to be educated about some of the things that they're going to see, some of the things that are happening, so that they can recognize them.
Actually, that was going to be my next question. For example, for addicts, drug addicts, alcoholics, they will have maybe violent response to treatment. Can you see this in persons who are suffering from eating disorders, like during treatment?
Well, and from my experience, I have not seen violent response, but it's not to say it cannot happen, because what you're doing is you're asking somebody to change their thinking, to change those irrational beliefs and a lot of the things that they have seen in the media, these totally how should I say, unrealistic ideals of what a person should be. And that brings me also to cognitive behavioral therapy, which is another form of therapy, which has actually been shown to be probably more effective than medication, right? Because what happens is once you're able to change the thinking, you're then able to change the behaviors. To answer your question as far as seeing some form of hostility, that may be also with the co-occurring disorders. Remember I said that you can have things like depression. Anxiety disorders, such as phobias, and you may also have some form of anger too, because that may also come, if we think about it carefully, that may come too from the abuse, a residual anger from there. Because what you're looking at too is you have to not only change the eating pattern, but you're going to have to deal with whatever psychological effect that has caused them to be in this eating
So how does
pattern.
depression factor into this eating disorder?
Very good question. Depression factors in the sense that, again, of the thinking. Let's say, for example, you have a female, because females are more prone to this. You have a female who may be looking at herself and feeling, you know what, I'm not pretty enough, I'm too fat, I just can't measure up, I don't look like my friend, I don't look like that supermodel, I don't look like that person. And what depression really is, it's a sense of feeling like you are just not worthy, you're not there. You have this sense of just a sense of not loving yourself, right? And so that again comes from the image that you think it should be because of what you've seen. So that's how depression can factor into that. You also mentioned substance abuse. Substance abuse can also be a co-occurring disorder with eating disorders as well.
Wow.
Yeah, the research has shown that as well.
That people move into abusing.
Yes, yes.
So does medication, do you give people with eating disorders medication? And is there a fear that they may become dependent on this medication?
That's a good question. And every time anyone ever asks me about medication, I say I'm not a psychiatrist. It's not my expertise, but I know something. So I'll share my something that I know.
Okay. I like that.
So I'm not going to sit here and pretend to be an expert on medication. But medication is a treatment, yes.
Yes.
And from my understanding and from my knowledge of it, the medication, again, would be vis-a-vis a lot of the side disorders that you're having, the depression. So you would want to utilize medication for that. And even some of the anxiety to counter that. Okay? So medication for that. But as far as with the eating disorder, now you can have medication, especially with bulimics, because remember what's happening is they're losing a lot of the nutrients because they're continuously purging. And there's this hormone called serotonin that controls your appetite. Okay, and you can have medication that will do what? It would balance it out, it would even it out, and it would just normalize it. And so that way you are not then craving or wanting to eat too much and then binge.
I see. And then again, you have to be monitored for the medication to ensure that the medication is being taken.
Yeah, and yeah, definitely with any medication, any disorder, you have to be monitored, make sure it's being taken, see what some of the side effects might be to that. And then again, that's where families come in, parents, loved ones. Yeah.
My medication, because I didn't love food growing up, and so my medication was some good licks. You know, but then
I didn't like food.
Behave yourself.
But I didn't like food growing up either. I would know. I had this thing where food was like, you know, take it or leave it. Who cares?
Medication was found the fool and see.
You know.
But then the side effect from that is that I developed a habit of eating quickly because I didn't like the food. I wanted to get it down as fast as possible.
He's trying to justify his fast eating.
He's doing something. He's having insight. I was just going to say.
I'm self-diagnosed.
He's self-assessing, which is good.
Which is a good thing, right?
So
self-assessment.
We know he needs counseling. But with the people with eating disorder, do they have to go through counseling for a certain period of time, or do they need to stay in it for the whole of their, their life?
That's a good question. Therapy or counseling, psychotherapy, we use those words interchangeably, definitely is needed. I mean, in addition to medication, because the medication only deals with what? The physiological, right? And with therapy, we want that deals with the mind, changing your thoughts, your thinking, and also changing, which would lead to changing the behaviors. How long should we have it? Very good question. I mean, there are persons that have been in therapy for eating disorders for years, because what happens is that there's this. It's just like with substance abuse. You know, you go to your AA meetings. You have your sponsor, all of those things, right? So it is a continuous process. You can have someone that might be in therapy for 6 months, and then they just taper it up, and they go maybe every once a month. They check in, and there are also self-help groups for that. You can go to groups, and that can be your continuous counseling. You don't necessarily have to go every week to a counselor like myself. So it's a continuous process, because you don't want to relapse, whatever the triggers are. You know, I mentioned the abuse, and so the key is, if you haven't dealt with those causes, those things that have caused it, it will continue to come up. And so that's why the psychotherapy, the counseling is needed to address those underlying conflicts, those underlying dynamics of what is happening.
You know, here in the Virgin Islands, there's such a bad stigma on people when they go for counseling, which is really bad. And because of that, it prevents a lot of people from seeking counseling. Do you have, since we're working down to our the time flies when you're having fun.
Oh my goodness!
So,
wow.
do you have any word of encouragement or any word to impart to the people about counseling, eating disorder? What you know, how it can help them?
Yeah. Well, first of all, you know, with any disorder, and since we're speaking specifically to eating disorder, I just want to let people know that don't feel like you're, and for lack of a better word, I'm going to use the word freak.
Right.
You know, don't feel like you're a freak, because a lot of times these things comes from our environment.
Right.
And some of the times, you know, we're only human and we're not able to handle them.
Right.
And if you find yourself in a situation where you do have a disorder, and again, the disorder, you're just eating fast. It doesn't mean that you have an eating disorder. But if you meet enough of the criteria according to the diagnostic statistical manual, it's okay, because you can have treatment. And what I want you to know is that you can live a life, a normal life, once you monitor it, and then you keep it in check, and you'll be okay. You know, so your life is not
You're
over.
saying you could live a normal, healthy life.
Yes.
Yeah, so it's not...
Yeah.
You know?
And another thing, too, just education. Just having the facts about nutrition, what it does to your body, and just being educated to know what eating disorders can do. Yeah.
And I know your practice is in this community, and so I think it begs the question quickly. Do you see an increase, or is the BVI relatively moderate when it comes to eating disorders, especially in our teenage women?
That's a good question. And how I'll answer that is to say, I haven't been back that long. I've only been back a year.
Okay.
But from my past experience, having lived here and having been here and reported cases, in my estimate, I would say it's not as high as maybe in the U.S. Is it there? Yes, it is.
Yes.
Because, you know, a lot of cases will go unreported. And I think just some of the things that we were talking about, parents need to just keep a check of. You know, keep a check of how kids are looking at themselves, how they're speaking to their physical body. Again, any really great signs, the absence of the menstrual cycle. You know, so their eating patterns, are they carrying things in their room to eat? You know, all of those things we talked about, to just kind of keep a check and see, what's really happening there. But I would say it's minimal.
Okay. I know of someone who exercises twice a day, run, go to the gym, all kinds of things, and every day. Now, at one time, I used to exercise every day, and I stopped. Now I only do 3 times a week. You know, and I watch what I eat. I don't eat big portions of food. Sometimes I do eat fast, but not as fast as him.
You might be in a rush.
But I had to, of recent months, I've had to stop because I've had issues with my stomach. So
you have to get out of gastrointestinal
yes,
problems.
exactly.
Yes,
so that develops, and so and then again, the tendency for me, I find I had to watch that because I was so concerned with what was going on, and I still am with my stomach. I was afraid to eat. And so that could lead, I believe, to that, where you don't want to eat because you're afraid of messing with the stomach. So, yeah.
That's a good point. I mean, that's a good point of how it can occur.
Yeah.
But then, you know, what I would say to you is definitely recognize and monitor your eating patterns. And I think, you know, what you said was a great thing, recognizing the damage that just eating so quickly may do to the stomach.
Right.
Yeah.
And also going without food for long periods of time. And then trying to fill it all up one time.
One time.
Yeah.
Exactly.
Is that what you do?
Yes.
We're going to send you upstairs soon, you know. And for just before we go, can you please tell again where you are?
Yes.
For the listening audience?
Again, my private practice is called Cimorge Counseling Consultation Incorporated, and I am right here in the Chevelle building on the 3rd floor. And should I give them my number?
Yes, you can. Yes, please do.
And this is my new location. My number is 346-0662, 346-0662. And you can also visit me on the web at www.cimorgecounseling.com.
Can you spell Cimorge?
Sure. Cimorge, counseling with one L, the American way, COUNSELING.com.
Thank you, and thank you so much for coming to me here this morning.
It went by so quickly.
Yeah, it went by so quickly.
Yeah.
We have fun here, right?
My pleasure, yes.
Yes.
My pleasure.
There you go. We are thankful that Dr. Cindy M. George, a mental health counselor and director of Cimorge Counseling Services, she was in studio with us taking a microscopic look at eating disorders, and I hope that the information you received this morning proved valuable. Some parents may be thinking, I'm seeing some irregularities here, so let me make a check. And you know where to contact Dr. Cindy George. Please do so. I want to thank you so much for staying with us another episode of CBN today. It was a pleasure having you on board with us. And our quote for the day, as usual, always provided by my lovely host, and it says to us, "Be more concerned with your character than with your reputation. Your character is what you really are. Your reputation is merely what others think you are."
Exactly.
And the quote is by?
Oh, John Wooden.
There you go. So thank you so much, John Wooden, for that quote. We think it's very valuable and fitting for our topic this morning. Again, have a good day. Watch out for somebody, be kind, and know that we love you.